Good morning, good afternoon, and good evening, everyone. And welcome to another session of the Scientist.com AI Innovation Series, this one titled The Role of Advanced De-Identification in AI-Driven Healthcare. I'm Liam Sanyo from the events team here at Scientist.com, and I'll be your host. Today, we're being joined by Dr. Khaled El-Imam, who's the Canada Research Chair in Medical AI and professor in the School of Epidemiology and Public Health at the University of Ottawa, and Patricia Thane, who's the co-founder and CEO at Private AI. Together, Khaled and Patricia will discuss how advanced de-identification techniques can protect patient privacy while unlocking AI's full potential in healthcare innovation. And I'm very pleased to welcome the first speaker, Dr. Khaled El-Imam. Khaled, thanks so much for joining us today, and the floor is yours whenever you're ready.
Great. Thank you, Liam. Thank you, everyone, for joining us today. I will start the presentation. I'll give the first part of the presentation and then be followed by Patricia. So to start off with, let me just situate what we will be talking about. We can classify the data sets that one would need to de-identify into tabular data and unstructured data. And the way you would actually go about the de-identification will depend on the data modality. So our focus today is on unstructured data, and I'll highlight the differences as we go through some of the slides and the points that I'll be covering as I go through my next set of slides. So when we're talking about unstructured data and more specifically around text, I'll use that as an example of unstructured data. De-identification is can be challenging for a number of reasons, and I'll assume everyone is aware of why de-identification is necessary and the benefits of de-identification. So I'll just jump right into the processes and the methods that can be used for that. So for unstructured data, and specifically text, one common way that is used is to apply regular expressions to identify patterns in the data, and then replace those patterns or redact them or resynthesize them by generating alternative realistic values to replace the original values. The regular expressions have limitations because they cannot cover all the possible scenarios, especially for scenarios that were not anticipated. We see organizations trying to develop their own internal de-identification solutions. So I've been involved in de-identification for a couple of decades now, including developing software tools and deploying them, and building de-identification solutions is very hard. It takes a lot of resources, and they must be maintained over time. The technology evolves, and the nature of the information that needs to be de-identified also changes over time. So homegrown solutions are a challenge to develop. They require a lot of technical expertise and require a lot of investment to sustain over time. So for a lot of organizations, that's not a realistic option. And then we see also interest in using large language models as a de-identification tool. But self-training LLMs or building your own LLMs to perform the information extraction from text is just not practical for many organizations due to the significant costs that are required to train those models. And then the other consideration is privacy legislation. For example, in the U.S., many states are introducing privacy legislation, and there are inconsistencies or incompatibilities among them. So the interoperability among the statutes that are being introduced can present a challenge, and there's still states introducing privacy legislation, and there are also new guidelines and standards being introduced. For example, the ISO standard on the identification just came out just over a year ago or so. So the field is evolving, and staying ahead the requirements and the expectations can be a challenge, especially if the identification is not your core business. It's something that needs to be done to leverage data, but it's not part of the core business of the organization. So under all these conditions, you need to look at alternative solutions, at tools that are available in the marketplace, and so that's what Patricia will cover. Leading up to that, I will talk about just some methodology around data identification and give you some of the high-level principles for de-identifying health data. So this applies to all data modalities, tabular data and unstructured data. In general, when we look at any type of data, we try to classify the information in there as direct identifiers and quasi-identifiers. And in the context of unstructured data and text, you use information extraction capabilities to extract direct identifiers and extract quasi-identifiers. And the distinction is important because the way you treat those two types of information is different. So direct identifiers are pieces of information that an adversary or an attacker or an intruder would know that directly identify the data subject. So, for example, the patients in the data. So examples of direct identifiers would be names, addresses, telephone numbers, and email addresses, and any type of biometric, for example. And as is obvious, if they're direct identifiers in any document or in audio or in a tabular data set, you would want to remove that or encrypt it. And then quasi-identifiers are other types of information that an adversary would know that can be used for re-identification. So these would include things like all dates and locations are considered quasi-identifiers. So dates of birth, dates of death, dates of transaction, date of a visit, episode, encounter, etc. And other types of demographics such as race and ethnicity. So and many known re-identification attacks were performed using quasi-identifiers. So we know that attackers can use quasi-identifiers to launch successful re-identification attacks. So these are the types of information that you would normally want to focus on when you're de-identifying any type of data set. So how do you go about de-identification? And I like to focus on HIPAA and the US HIPAA privacy rule because it actually sets a standard and defines commonly used methods for de-identification. And the kind of the HIPAA was one of the first regulations for that. The HIPAA privacy rule first regs to define methods for de-identification, so it preceded many of the other ones, but also it exemplifies many of the things that came afterwards. And there are two methods under HIPAA: the expert determination method and the safe harbor method. So let me start off with the safe harbor method, and I'll try to highlight the strengths and weaknesses of each one of those as well. So safe harbor has two requirements. You have to remove or modify one of these 18 pieces of information, and many of them are direct identifiers. You can see names, fax numbers, email addresses, vehicle identifiers, device identifiers, etc. So these would normally be identified, or you detect them in the document, for example, and you would typically redact them or replace them. Resynthesize them with fake values. And then you have things like number 2 and number 3, geographic references and dates. So geographic references would be zip codes and dates, or dates of events. And these would need to be generalized, so zip codes to the first 3 digits, unless the zip code has less than 20,000 people living in it based on the last census. And dates on all dates have to be generalized to the year. So if you do all of those things, then the data set is deemed to be de-identified. And the advantage of safe harbor is that it is very simple, can be applied in a generally very automated way, and it's applied to every data set. So every document, for example, that you identify, you'd go through and identify those elements and then remove them, redact them, replace them, etc. So that's one of its biggest strengths is really simplicity and ease of application. And its weakness is there may be other pieces of information, other quasi-identifiers in the data that is not covered by this list. And then the second requirement under safe harbor is that no actual knowledge that any residual information can identify an individual in the data set. And this essentially means that there's no obvious way in the data that someone can be re-identified. If you look at example 1, if it says the former president of the state university um, identifies the occupation of a patient as the former president, then immediately know who that is. So that's actual knowledge about an individual that would result in their re-identification. From my experience, and just very practically, most folks most individuals or organizations just focus on the 18 list of 18 because interpreting their own actual knowledge is challenging, and it's not always obvious whether this is you have actual knowledge or not. So safe harbor is generally interpreted as the 18. The second method is expert determination. And in a few words, in kind of these short paragraphs, it actually captures a lot of very important requirements. So first of all, it requires that a person with knowledge and experience, so it requires expertise. You have to know what you're doing if you're applying this expert determination method. There's no list. You have to do an analysis of your document or your data to determine if the risk of identification is very small. So you have to have someone who's with experience to do this. Then you have to use generally accepted statistical and scientific principles and methods. So you can't make stuff up, and you have to use generally accepted methods such as ISO standards or any other guidance document from HHS or other regulators. And then you have to apply those methods and principles to ensure that the risk is very small. So you have to be able to measure the risk, and you have to set a threshold for what is small, so you can show and demonstrate that the measured risk is actually below that threshold, and then that the information in combination with other information that's reasonably available. So it's a reasonable standard, and it doesn't require you to scour the universe to find all possible information that an adversary may have. There's really a good reasonableness standard there. And it's by an anticipated recipient. And this is really, really important because you're evaluating the risk of re-identification from the perspective of the anticipated recipient, not from the perspective of any third party. This is in contrast to other regulations and other guidance from different jurisdictions where they don't make that clarification. You're evaluating the risk from the perspective of the anticipated recipient, and that results in very, very big challenges in doing a risk assessment. So HIPAA is really good in that regard. And then you have to document your methods and results. So expert determination is essentially a statistical analysis that's performed by an expert. And in the context of unstructured data, what you would typically do is get an example set of documents or examples. So I'll use documents as a way to demonstrate this. Let's say you get 200 or 300 documents representative of the types of documents that you want to de-identify. You would manually annotate those to determine where the direct and quasi-identifiers are. And then you would apply your technology, your de-identification tools on that ground truth, the annotated 200 or 300 annotated documents. And then you'd evaluate the performance of your tools on these documents because you have the ground truth. So you know how good the tools are at identifying the direct and quasi-identifiers. And once you have those metrics, essentially precision and recall, once you have the metrics about how your tool is performing on these example documents, then you can compute a general performance evaluation on for all documents of that type. Right. So if you're looking at, for example, problem reports or progress notes, you'd annotate and have a ground truth. You'd apply your tools, compute precision and recall, and from that you can determine the re-identification risk of documents that would be de-identified using that technology. And that's it. You wouldn't actually do this process for every single document afterwards. You'd come up with a risk assessment that applies to that class of documents, and you have to make sure that that class of documents is representative of the documents that you want to identify moving forward, which is different than tabular data. Tabular data, you apply the identification process for every single data set and the risk assessment process for every single data set. The way you do it is exactly the same, like the principles are the same, except for text. For example, you have this information extraction step that is necessary that then drives everything else from a risk assessment perspective. So hopefully that gave you an idea of kind of some of the basic principles behind the identification and the contrast between tabular data and unstructured data. And now I'll pass it on to Patricia to talk to you about the need for identification within for AI applications.
Thank you so much, Khaled. All right, very excited to be speaking to you all about this. So when it comes to de-identification of data for AI purposes, it can be quite tricky because a lot of the times you're not quite sure what parts of the data are being obfuscated by these AI systems and what you really need to pay attention to. When it comes to thinking about privacy in particular and AI systems, it's not a new topic. In this article for example, from 2021, this Korean chatbot company called Scatterlab had been boasting about the billions of conversations they had between users and had been using those conversations to train their chatbot, and out came entire names, nicknames, home addresses, so personal information from these users that had been quote unquote memorized from these models from those billions of conversation logs that they had. There's also research in 2019, this paper called The Secret Share, Evaluating and Testing Uninterrupted Memorization in Neural Networks. And this tested what's called a character language model. So instead of predicting the next word, it predicts the next character. And with these models, you can also test how surprised they are at seeing the next piece in the sequence. And so what the authors did here is they made a random number, kind of mimicking a social security number, stored it in the Penn Tree Bank database, which was used to train this character language model. And then they measured log perplexity, or the surprise of the model at seeing the sequence of numbers. And so they put in the sequence of numbers that they had stored in the training data, and they put in other random sequences of numbers. And the sequence of numbers that was stored in the training data had less surprise. So that 14.63 is less surprise from the model at seeing that sequence. So what we're seeing there is also memorization from a character language model perspective. In this other paper by Abdallah et al. From 2020, they showed how when you create embeddings, so these vectors representing the words within a healthcare data set, in this case, it actually was fairly straightforward to find which names were closer to which last names were closer to which first names, and which names were closer to which conditions. And so what they were warning against in this paper is if you are creating these embeddings, you do have to be conscientious of what kind of personal information are in the source data or in the contextual data in order to create those. And this is very, very relevant nowadays when we're talking a lot about RAG embeddings informing large language models so that you can ground the models on something that's more realistic to your organization. In this paper over here, what they cover is how even dense embeddings, meaning embedding vectors that are representing large amounts of text, from them you can still recover 92% of the information. And here they say we train our model to decode text embeddings from 2 state-of-the-art embedding models and show that our model can recover important personal information, full names, from data sets of clinical notes. So once again, just because it is in vector format, it doesn't mean that you can just use any data to create these. You still have to be very cautious about what kind of protected health information you're using and such. So when it comes to privacy in large language models, since that is what we're kind of using as a term for AI nowadays, there are several locations where you have to be worried about or conscientious about what kind of data is being transferred. If your large language model lives in a third party, you have to be conscientious about the training data and fine-tuning data you're sending to them, the contextual data you're sending to create RAG embeddings, and the information that you're sending through within the prompts of the users. If you have a local large language model within your organization, then you might still want to remove the personal information from the prompts of the user before it even reaches your environment, potentially, so that you're not storing any information that you shouldn't be storing. You can, of course, do the sanitization process afterwards. It really depends on the user that you have. as I mentioned, with regards to memorization of training data, it is important to de-identify the data before training or fine-tuning the large language models that you're creating. Of course, the contextual data that you are using to create these RAG embeddings, that should be de-identified, or at the very least have a proper privacy impact assessment and make a decision afterwards according to your use case. And then as a measure of last resort, you can also de-identify data going from the large language model response to the end user if there happens to be any sensitive data that you think should not be there. Think an account number, financial information, information about a particular disease that you didn't want the end user to query about. Also very use case dependent, but very flexible depending on what it is that you want them to see or not. And one really interesting use case that I wanted to call out, or case study in particular, is this one with Providence Health that we had been doing actually prior to the LLM boom, where they'd been scrubbing personal information from patients' conversation with a smart assistant. And that was in order to get access to those conversations so that they can inform their smart assistant further. And so if you are sending data to your data science teams, it is really, really good practice to de-identify the data before they even get access to it. And afterwards, they can even use that data more responsibly, more reliably for AI applications, including training chatbots, for example. And when you're looking at removing personal information from the prompt aspect of it, if you're wondering about usability, the really interesting thing about unstructured data is that there's a lot of value in the content around the personally identifiable information. So in this case, we're de-identifying the prompt, sending draft me an offer letter for name 1 of location 1 for the position of occupation 1 that's being sent to your large language model of choice. And that re-identification process happens in the response. So that whole de-identification of information and reintegration of personal information can happen within your customer's environment, within your own environment, before you're sending data to a third-party large language model. And so that very much minimizes the transfer of personal information to either yourselves or to third parties, or even within the organization. Now, with all of this, you might be thinking, this is great, but what am I really looking for in a de-identification solution if I've got all of these different types of data, I've got AI applications to build? And what a few questions to think about are, how accurate is the solution? How scalable is it? How customizable is it? Does it address all of the languages that I'm going to be dealing with, all of the multilingual peculiarities from the various locations that I'm dealing with? So for example, if you're dealing with US addresses and identification numbers, does it also transfer over to Japanese addresses and identification numbers if you have a multinational organization or multinational clients? Does it deal with multiple types of unstructured data? So are we dealing with text? Are we dealing with audio, images, documents, semi-structured data? And as Khaled covered, is it keeping track of privacy legislations globally? And the reason this is a really hard problem is generally because you are dealing with very large volumes of data. You have that patchwork of privacy legislations. You've got this multilingual and multinational data. And you're also dealing with a lot of different types of content, a lot of different types of documents. You might be dealing with audio recordings where you might have disfluencies in speech. You might have optical character recognition errors from translating those documents into something that's comprehensible by the computer, or you might have automatic speech recognition errors when you're doing speech to text. And so dealing with all of these parameters can get very, very tricky very quickly when you're also dealing with trying to understand all of the different types of personally identifiable information that can appear in these types of data. For clinical notes, for example, you might be dealing with messy dates. You might be dealing with optical character recognition errors, which are particularly difficult when you've got, for example, doctors' handwritings that are scanned. So all of these have to be taken into account when you are considering the type of solution for you. There is also the ability to replace the names with fake names, locations with fake locations, dates of birth with either fake dates of birth or date shifts of these dates. And all of this helps with what's called hidden in plain sight. And so that reduces the risk of re-identification, since you don't necessarily know what the original data was from the fake data, if anything was accidentally missed, or if there's any personal information that may not have been accounted for. Another thing to consider is how complex the documents that you're handling are. So is there tabular data? Is there writing? Are there logos? Are there, is it native native PDFs, native documents, or are these scans of documents? Are these pictures of the documents that you're handling? How you deal with them also varies a lot based on what you want to do downstream with them as well. And another thing to think about is which environment you want to deploy your de-identification solution in. So the way that Private AI deploys is a container directly within your environment. Several of our customers are on Snowflake, for example. So being able to deploy a container within the Snowflake or Snowpark is important for them. But it's very important to think about, will this transfer over to where I need this to live? Since healthcare information oftentimes cannot just be transferred willy-nilly to third parties. And finally, how you assess this through third parties can be important, because it's very difficult to just know by yourself, given the amount of options that are out there with regards to potential for de-identification, whether or not you're using the right tool. And a few things that you should think about is there third-party verification that can help with this? And the way that this can happen is either through a model verification or through data verification. And oftentimes both is a particularly good way of going about it. But one option, for example, in this model assessment summary that we did with Armilla, that's warranty backed by Swiss Re with regards to accuracy, is checking on, it also checks performance, it checks bias and fairness, it checks robustness, and it checks the processes and governance of the models as well. And Khaled, do you want to take this one?
Yes, so this is just another example of a analysis that was done of the private AI de-identification tool. And in this case, as the paragraph shows, there was a sample of clinical notes that were manually annotated and then used as a ground truth for evaluating the performance of the tools. And there are actually multiple tools that were evaluated, and the outcome of that assessment was demonstrated that the private AI technology was quite a bit superior to alternatives that were available at that time for the particular project. And this was not a long time ago, it was relatively recent. So that's a completely independent assessment of the technology for the identification of clinical documents.
Thank you. So I'm gonna end this by saying that in the healthcare space, you're in a particularly advantageous position compared to other industries, because you've got certain legislations like HIPAA that really tell you what it is that you need to do in order to unlock the data for secondary purposes, which a lot of data protection regulations don't tend to be as clear about. So not only are you more used to dealing with de-identified data and getting value from de-identified data and have less confusion about that and much more clarity around what it is that you can do with de-identified data than other industries, but you also have the legislative guidelines that enable that use of the data. So good on you guys for being able to have a jump start on the kinds of the understanding that you have around the use of AI with regards to the data sets that you can take advantage of. So thank you so much. Opening it up to question period, and appreciate the attention. Let's see what's in there.
Excellent. Thanks so much, Patricia and Khaled, for the great presentation. So first question is a good one. So how do you evaluate the accuracy of your solution?
Yeah, great question. So the way that we evaluate the accuracy of the solution is by measuring precision and recall on a variety of different types of data, on a variety of different languages as well. But also we do it from a customer by customer perspective as well. So if they have a certain type of data that they need to process, we will even help them in the process of evaluating the accuracy of the solution on that type of data.
Fantastic. Next one here. What are some current or future features that make de-identification systems stand out?
Yeah, great question. So we just rolled out co-reference resolution, for example. So if you have names that are of the same person but not spelled out in the same way, or if it says, for example, Khaled and then Dr. Khaled El Imam, being able to make sure that those two are linked together is something that is very tricky to do, and that we have a version of for you to try if you're interested. Other than that, we also have date shifting rolling out and other very healthcare specific features to help with the de-identification process while maximizing the amount of context that you could keep of the data on the roadmap for the near future.
Fantastic. And there's actually another question, you touched on this, but asking how would redaction work when dealing with abbreviations like exams or diseases, or name variations like Dr. Lee Smith or Dr. Smith?
Great question. So it's contextually based. So it would pick up the exams or diseases based on the context, and it would pick up the name variations also based on the context. But with that co-reference resolution feature, it would have Dr. Lee Smith linked to Dr. Smith.
Excellent. Thanks a lot. All right. Someone here says, I'm struggling with de-identification of unstructured data in my business while meeting the HIPAA standards. There are no tools today that can de-ID at 100% accuracy or really even close. So how do you proceed with unstructured data to ensure that the data is being safely utilized?
Do you want to take that one, Khaled?
Yes, absolutely. As Patricia mentioned, the way to evaluate text and documents as an example of unstructured data and how well the identification is occurring is through precision and recall metrics. And it's not, the standard is not 100%. You're not going to catch everything 100% all the time. That's not a practical standard. But what the standards that are typically set are quite high for direct identifiers. So you want to catch almost all of your direct identifiers, like 99% or so, like within that range, 95 to 99%. And then the standard for quasi-identifiers is a little bit lower. And these work quite well in practice, and they're quite protective. You also have to remember that if you do resynthesis, so if you're replacing a value with a fake value, you have the hiding in plain sight concept that Patricia mentioned, where you don't know whether a value is a replacement or an original value, and that adds a lot of uncertainty to any attack. So even if the accuracy is 99, you have this additional layer of hiding in plain sight and not knowing whether a value is resynthesized or real. Essentially makes it very difficult to know what is that last 1%. So as a practical matter, it's just very difficult to re-identify that data, that type of de-identified data, if you meet those precision and recall standards that are typically used in this space.
Fantastic. Thanks a lot. Another question, and I think it was touched on a bit, but I think an important question nonetheless. How do you handle de-identification for non-textual data types like documents?
Mm-hmm. Yeah, so it depends on what the end user wants to do with the documents. But the way that we handle it is by doing optical character recognition first, generally, and then blurring out the PII within the document. There's also the replacement of those entities directly within the document, for example, docx, for instance. The trickiest part are documents with tabular data, for instance. So we do have special techniques to deal with tabular data within those documents, and that could be what you remove there can be dependent on whether or not you need to keep any of the data for analysis, and in which case you might bring in more complex structured data de-identification methods there. And with regards to audio, for example, you can bleep out the personal information. You can modify the voice as well. The better thing to do for audio, though, is mostly deal with the transcript, if that's something that you're able to do. And for images, it could be things like removing faces, removing license plate numbers, which doesn't really happen on healthcare data, so mostly faces, and also information like if ages or dates are in the images, those tend to be blurred out.
Excellent. All right, interesting question here. What are the limitations of using self-trained LLMs for de-identification?
Yeah, that's an interesting question. So if it depends on how much data you're dealing with, but it's very similar to the limitations of training your own machine learning model generally for de-identification. As Khaled touched upon, it takes a lot of effort to create de-identification technology. And not only do you need domain-specific knowledge, you also need knowledge on the privacy space and what's going on in the regulatory landscape. And you need to constantly refresh the data sets that you're dealing with. But then when you're dealing with large language models, you also have the constraints around the cost, the speed. The speed can be a huge issue as well. And if you're doing it through prompting, the responses that you get through prompting are not something that you can deal with in a reliable way. And so you're basically creating a nightmare for your developers if that's what you're trying to do with your data.
Excellent. Next one here. Somebody said, is the industry moving towards a standard for collection of tools? They said they've seen Salesforce's Einstein trust layer includes 0 retention agreements with the model providers and audit capabilities to regularly review data inputs and outputs. So how do we best combine all of these protection methods?
Mm-hmm. Yeah, that's a great question. Do you want me to take that one, Khaled, or do you want to take it?
Why don't you start, and then I may add some comments afterwards.
Sounds great. With regards to how the industry is dealing with that, it's like cybersecurity tools in general. You combine them in order to prevent the bad guys from getting in as much as possible. And it's the same thing with data retention. It's the same thing with privacy tools. What you're doing is building a high enough wall to prevent bad things from happening. And if something bad happens, to prevent it from being disastrous. So there needs to be a combination of tools generally, because no one company is the best of the best in each of these tools together. And so bringing them either together through a system integrator or through a CIO or CISO who understands how to meld them tends to be the best practice when it comes to cybersecurity.
Yeah, just to build on that, I mean, as with security, you want to have layers of protection, so you can apply multiple tools. The identification with trusted environment to give you higher levels of assurance. I think also it'll depend on the sensitivity of the data and the risk appetite of the organization. Very conservative organizations would tend towards more layers than less conservative organizations. So a number of factors to take into account there.
Excellent. And I think a nice question to build on that. So somebody asks, as there are a number of companies on the market selling de-identification services, What would you be looking for if you're looking for an automated tool for this?
Yeah, so I touched upon that in the presentation. There are a few things. It's really taking the data that you're dealing with into consideration. So are you dealing with structured data or unstructured data or both? Do you need the two types of data to have de-identified data be linked together in some way? Do you deal with multiple languages? Are you dealing with multiple jurisdictions? How much data are you dealing with? If it's a huge amount of data, is the solution scalable? And how many types of documents are you dealing with if you are dealing with unstructured data? How many, is it docx, is it XLS, is it PDFs? So it has to be a solution that is well-rounded for your particular needs. Anything you'd add there, Calvin?
I think I'm evidence-based, so I'd also emphasize you really want to gravitate towards products where there is compelling and convincing evidence to show that they perform well. There are a lot of claims made about different tools and so on, and the liability from not getting this right can be quite high. So you also want to examine evidence evaluations, as Patricia showed, third-party evaluations, demonstrating that the technology works under different conditions for different types of data. I think that's very important. And if we're talking about the healthcare industry and pharmaceutical industry and medical device industry, I mean, these are all evidence-based, evidence-driven industries. So the idea of using evidence to choose technology should not be foreign either, and should be applicable here as well.
Yeah, some great points there. Thanks both. All right, another question here, which is maybe more of a comment. But do you think DID is a bad term as it implies a binary outcome when, as you said, this is more about risk reduction to find a balance for each use? But can you comment on that?
Sure. Normally we talk about the identifiability spectrum, where re-identification risk or identifiability is a value along that spectrum, and then there's a threshold on that spectrum, and when you cross that threshold, your data becomes non-personal information or de-identified. So even though it's on a spectrum, you essentially convert it to a binary concept to be compatible with legislation, which only defines personal and non-personal information. It doesn't make this graded distinction. Well, I mean, if you include pseudonymous information, I guess there's another state of data there, a third one, like pseudonymous, de-identified, and personal. But in general, it's really a binary concept. Arguably, yes, it's a bad term, but I don't think this is the battle that we want to have. I think there are other. If we're going to change legislation and change regulations, this is not where I would suggest our effort should be focused. I think we need clear regulations, practical regulations, more precise regulations to reduce uncertainty around de-identification. Rather than I wouldn't focus on the terminology, because also the other challenge is different jurisdictions use different terms. So in Europe, for example, and some Canadian jurisdictions, the term anonymization is used to mean de-identification. So terminology is a more complex topic, just because there's also inconsistencies around the world with respect to the terms to use to mean certain things.
Yeah, and also it's it can be tricky across jurisdictions to know exactly how to certify that your data has been properly de-identified or where on the spectrum it is. And so outside of situations like HIPAA, where it's very specific about what you need to do, it's sometimes just left to the company to decide whether they did the best thing possible or not. And then you end up with situations like people who don't understand de-identification, leaving things in like dates of birth or other quasi-identifiers that can together really pinpoint an individual to a small group of folks. And so that re-identification risk is quite high. And so in general, terminology and regulatory compliance requirements can be a little vague.
Excellent. Yeah, some great points for both. And I think with the, we just have one last question here. So does the platform support de-identification of DICOM, which is, I think, radiology formats?
Yeah, great question. So we do a little bit of that with regards to de-identifying it by removing the dates and other personal information that's written out in text on the images. However, it is a little trickier if you're dealing with things like 3D images. So that's something that's on our roadmap that we don't currently support based on the demand curve. And I will add that it is very much still a research topic with regards to how you're de-identifying images, whether the image itself is something that could be used for re-identifying an individual or not. And you could have pieces of jewelry, for example, in radiology images that could re-identify somebody. But even the scan itself might be considered a biometric of sorts. And so what most people do is de-identify the text within the the DICOM image. And so far it seems like that's fairly accepted, but I would emphasize that the rest of it is very much a research topic. I don't know if you'd add anything to that, Khaled.
Yeah, I mean, DICOM, in DICOM files, you have embedded headers in the files with structured text. So text by default. So I mean, it's relatively straightforward to extract the headers, different types of headers, de-identify those, and then push them back in. So it's not only the image that needs to be de-identified, it's also the headers, and the headers would be straightforward to work through with the text identification tool.
Yeah. So we do remove the headers and any text that's on the image itself, but so in summary, to a certain extent. I'm happy to talk your use case a little bit more.
I think to close things out, just ask a forward-facing question. How do you see this field sort of evolving over the next 5 years? But Khaled, do you want to start?
Well, from a technology perspective, I mean, I think there's a lot of excitement about using LLMs to improve the identification process, and I think that's still a work in progress to fine tune that approach and how that will play out. So there's a technology thread. Another thread I think is on the standardization regulation side. So I think there'll be more standards and more regulations coming out, providing reducing the uncertainty around how to do the identification, so that organizations can understand the rules of the road basically, and what they should and should not do. So make it clearer. And I think this is going to happen globally at different rates. Like some jurisdictions will move faster than others, but I think we're headed in that direction. Better standardization and clearer regulation on this topic. I mean, on the adoption side, I think we're at the point where mass adoption. We're at the beginning of mass adoption now. Finally, it's taken many years to get here, but I think just there's a general understanding that this is important, and that is just necessary for conducting business. A lot of organizations it's becoming clear that data is critical, and they have to find ways to use their data and acquire data and apply that data for decision making and for building tools to support their business. And so they'll have to deal with the privacy question. There's no way around it. We're seeing, for example, in the privacy community, just a very rapid growth in demand for privacy professionals, and this just reflects that the issue is very salient, and it's a key enabler, if done properly, a key enabler for the business. So I think that option will also be growing quite a bit over the next few years.
Yeah, so those are great points, Khaled. From a technical standpoint, I think, well, what we're working towards at Private AI is making a lot of the usability versus privacy trade-offs something that's very easy to calculate and do when it comes to unstructured data. And also increasing the usability of that data when it is de-identified. Things like co-reference resolution, like automatic date shifting, the pseudonymized information. All of that can increase the usability of your de-identified data, and also can, in some cases, decrease the re-identification risk. And being able to pull that into anywhere within your software pipeline, regardless of the kinds of data that you're dealing with, is a dream of ours, and that's how we deploy as a result of it. Very developer oriented towards dealing with massive amounts of data as well. And it's a huge issue because of how much data there is out there and because of the complexity of the data. But what AI is doing is it unlocks a lot of the value of the unstructured data that's out there, but privacy is still a major concern. So how do you tackle that before you feed it into your AI models?
Definitely. Well, yeah, a pair of really great answers. Thanks so much, both for your insights in the presentations as well as a great Q&A. It's really been a pleasure having you two with us.
Thank you so much. Really appreciate it.
Thank you.
My pleasure. All right. A big thanks also to the audience here for participating. And in closing, we hope you enjoyed this Scientist.com and Private AI webinar, and we hope to see you again next time. Have a great day, everyone.
Thank you.